Welcome. Let us discuss about congenital abnormalities. Congenital anomaly, birth defects. Congenital anomaly is any medical condition a person has from birth. Types: structural and developmental. If they are structural, it means they relate to body parts. If they are developmental, it means that they affect the way the body works, how a person learns, or the senses. Structural anomalies. Heart defects. It has no obvious cause, but if a pregnant woman has diabetes or smokes during pregnancy, it may increase the chance. A heart anomaly occurs when part of the heart does not form properly in the womb. It can affect the blood circulation around the body. There are many different types of heart defects depending on the affected area of the heart. The most common heart defect is a ventricular septal defect. This is a hole in the wall separating the two lower heart chambers. Sometimes the hole will close on its own over time. Infants with defects often need surgery soon after birth. Limb reduction. The cause of limb reduction is unknown. Exposure to chemicals or infections during pregnancy might increase the chance. It means that a limb is smaller than the usual size or missing altogether. For example, an infant may have a missing finger, clubfoot, or an arm that is shorter than usual. Physical therapy, splints, or prosthetics can help. People with minor limb reduction may find that it does not affect daily life. However, others may find certain movements more difficult or not possible. Cleft lip and cleft palate. It is a facial cleft. These are the openings or splints in the upper lip, the roof of the mouth, that is palate, or both. This can affect the speech, eating, and hearing. Most infants will need surgery in the first few months of life. Smoking during pregnancy increases the chance of cleft lip and palate. Gut and stomach anomalies. Gastroschisis. It is a birth defect in which baby's intestines extend outside of the abdomen through a hole next to the belly button. Omphaloceal. It is a birth defect in which an infant's intestine or other abdominal organs like liver are outside of the body. Diaphragmatic hernia. The muscle separating the chest and abdomen is called diaphragm. If a hole forms in the diaphragm, the organs can begin to move into the chest. Neural tube defects. It affects the brain and spinal cord. Acencephaly. A baby born with an underdeveloped brain and an incomplete skull. Encephalocele. It is a sac-like protrusion or projection of the brain and the membrane that covers it in the skull. These defects are caused by failure of the neural tube to close completely during fetal development. Spina bifida. This occurs when the spine does not form and close properly. This affects nerve and spinal cord. Developmental issues. Down syndrome. A person with Down syndrome is born with an extra chromosome. This affects brain and body development. Visual impairments. The cause is an irregular eye shape, or the brain and the eyes do not work together properly. Hearing impairments. Here, the ear does not work properly. They may have some ability to hear, or they may be deaf. Most infants will have hearing screening before they are 1 month old. Fetal alcohol spectrum disorders. These can occur if a woman drinks alcohol during pregnancy. They can affect learning, growth, and development. Cerebral palsy. It is a most common childhood motor disability. It affects balance, movements, and posture. Muscular dystrophy. This affects the muscles, which becomes weaker over time. Genetic disorders. Some genetic disorders can affect development. The most common example is Fragile X syndrome. This affects normal brain development and behavior. Specific language impairment. It is a communication disorder. It can affect a person's ability to read, write, and speak. Diagnosis. Anomaly ultrasound. The ultrasound is used to know about different parameters of fetus and looks for any birth defects. Amniocentesis. During pregnancy, fetus is surrounded by amniotic fluid that can be used to detect genetic disorders in the fetus. It is not routinely advised to all the pregnant women and is recommended in pregnancies with high risk factors for the congenital disorders such as pregnancies at advanced stage for Down syndrome, muscular dystrophy, sickle cell anemia, thalassemia, and cystic fibrosis. Chronic villus sampling. In this test, cells from chronic villi, that is, tissues from placenta, are examined for chromosomal disorders such as Down syndrome. CVS is not routinely offered to all pregnant women. Environmental factors. Maternal exposure to certain medications, psychoactive drugs, tobacco, radiation, and pesticides during pregnancy may increase the risk of congenital anomalies in fetus or neonate. Working or living near or in waste sites, smelters, or mines may also be a risk factor. Maternal nutritional status and medical conditions. Iron deficiency, folic acid deficiency, excessive vitamin A intake may affect the normal development of an embryo or fetus. For example, folic acid insufficiency increases the risk of having a baby with a neural tube defect. Obesity, diabetes mellitus, and seizure disorders may increase the risk of certain birth defects. Socioeconomic and demographic factors. Consanguinity, when parents are related by blood, increases the prevalence of rare genetic congenital anomalies. About 94% of severe congenital anomalies occur in low and middle income countries due to poor access to sufficient and healthy food, increased exposure to various infections, and alcohol, cause fetal alcohol syndrome, and insufficient healthcare delivery system. Maternal age. Advanced maternal age increases the risk of chromosomal abnormalities such as Down syndrome,